A lot of women, like we talked about, feel like we should tough it out, or I'm so happy because I have a baby, and feeling, like they shouldn't, be like this. And so they hide it. It's shame, right? Where's the
Yeah.
line? What is it that we should be
hmm
encouraging our folks to do rather than suck it up?
Yeah. Here's what I always would say to my patients. It doesn't matter how much you wanted to be pregnant. It doesn't matter how much you wanted a baby. You might have gone through 10 years of infertility treatments and now have this newborn at home. It is still okay to not be okay because until you are in the thick of it in that postpartum period, you just have no idea what having a newborn is like, for first time parents. And then the second thing I'll say is these things are biologically out of your control. A lot of the things that contribute to postpartum anxiety disorders and postpartum depression. So, don't feel like you should be over the moon at all times because that's probably a very unrealistic expectation. It's okay to cry. I don't know anyone who's made it through the newborn period without some tears of frustration or, some worrisome thoughts of, am I doing this right? And that's all very normal. What I'd say, is like at the time to seek help is if you're crying all the time, if you could sleep because the baby, but you can't, you just have these racing thoughts. If you can't eat, if you feel like you're not caring for yourself or for your loved ones well, these are reasons that you might want to seek additional help or think, oh, maybe this isn't just the typical baby blues that I've heard of. Maybe I'm crossing over to something else. The other thing is looking at the time from delivery and how long these symptoms are happening. Once you cross over that 2 week mark, most of those baby blues should be resolving. So if you're really still having symptoms that are significant, again, time to think, all right, it's time for some extra help. And, it's time for me to reach out to my midwife or to my OB and see if there's something else that is going on. The last thing I'll say is, and I think Dr. Tafera is going to go into sort of the spectrum of perinatal mood and anxiety disorders further. But of course, if you have any thoughts of hurting yourself, of hurting the baby, of hurting anyone else, that is a do not pass go. You need immediate assistance. You need immediate attention. And there is still zero stigma in that. There is nothing that you can do for yourself at that point other than get the help you need. So please, if any of that is happening, that's like you need immediate help.